In the present study, we found that the Leon score correlated with the intubation difficulty, and a Leon score of greater than or equal to 3 could predict intubation difficulty in trauma patients. Airway management is a challenging issue in adult trauma patients. Trauma patients may present with a variety of airway difficulties, ranging from promptly recognized to unanticipated difficult airways. 6. Moreover, most of trauma patients requiring emergency surgery do not have adequate time to undergo full preoperative airway evaluation, thus, they can be at an increased risk of unanticipated difficult airway. 4. 7. Therefore, it is crucial to be able to conduct a prompt assessment of the airway and predict difficult intubation. The Lemon score has been effectively used in emergency departments to predict difficult intubation because it can be determined based on the patient's appearance and observer's fingerbreadth, and it does not require special cutoff values or additional measurement tools. 5. 8. The Mallampati score component in the Lemon score is difficult to assess in trauma patient. 7. Therefore, the Leon score, which excludes the Mallampati score, has been used effectively in clinical situations. 5. 9. Although the Leon score has been validated and widely used in emergency departments, the definitions of difficult intubation in previous studies were ambiguous, that is, difficult tracheal intubation that requires multiple attempts in the presence or absence of tracheal pathology. In the present study, we used the IDS and defined a difficult intubation as IDS score 5, 2, 10. By using the IDS, the severity of difficult intubation could be quantified. This enabled an analysis of the correlation between Leon score and intubation difficulty, which can suggest a cutoff value of Leon score in predicting difficult intubation. It has been previously well validated that the Leon score can effectively predict difficult intubation in the emergency department. 9. However, comparing with previous report that showed the median value of the Leon score was 1 in both the easy and difficult intubation group. 5. Our results showed that the median value of the Leon score was 3 in the difficult intubation group and 2 in the non-difficult intubation group. Moreover, our results showed that limited neck mobility is an independent predictor of difficult intubation. This is in contrast with the results of a previous study that showed the thyroid to hyoid distance was not an independent predictor of difficult intubation. We thought that this difference may be because of our study population, particularly the high proportion of patients with head and neck injury. Head and neck injury is frequently associated with cervical spine injury. 11, 12. And neck immobilization should be considered even without a definite cervical spine injury. 13. The point in the criteria of limited neck mobility may have contributed to a higher Leon score in this study than that reported in the previous study. Moreover, limited neck mobility, which was found to be an independent predictor of difficult intubation in the present study, may also provide evidence supporting the importance of neck mobility in the airway management of trauma patients. The thyroid to hyoid distance, despite its clinical significance in a previous study, 5, did not significantly contribute the difficult intubation in this study, and the use of videolaryngoscope may have affected this observation. Compared with direct laryngoscope, a videolaryngoscope can provide an extended view in the vertical plane, which offers an advantage in cases of an anteriorly placed larynx. 14. A videolaryngoscope was used for the initial intubation attempt in 15% of the subjects, which may be large enough to attenuate the influence of the thyroid to hyoid distance in tracheal intubation. This study has several limitations. First, the study was conducted with a retrospective design via analysis of electronic medical records. Although the intubating doctor recorded the intubation information right after the induction of anesthesia, the data may have been unreliable because they were self-reported data. Moreover, because the initial intubation device can be selected by intubator's choice, a selection bias may affect the result. A relatively small population for a retrospective study also contributes to the result. Second, The results of the present study do not reflect patients with very severe and complex traumatic injuries that require immediate airway access. Because we evaluated patients undergoing emergency surgery in the operating theater, patients who underwent immediate tracheal intubation in the emergency department were not included. Third, we used an MBA to facilitate tracheal intubation in the present study. Since an MBA can provide the relaxation of soft tissues and comfortable condition without patient movements, the IDS score can be differed in clinical situations of tracheal intubation without an MBA. Conclusion. The Leon score may be used as one of the evidence predicting difficult airway, thereby being helpful to increase safety in the airway management of adult trauma patients undergoing emergency surgery. A patient with Leon score greater than or equal to third of may have the possibility of difficult intubation, and even in using video laryngoscopy, the limited neck mobility may contribute to the intubation difficulty. Abbreviation. IDS. Intubation Difficulty Scale. NMBA. Neuromuscular blocking agent.